say, don't get Botox. I mean, obviously, right? And for a dermatologist on social media, that's pretty rare to see. Botox is actually the #1 most popular cosmetic treatment in the world. But is it the right choice for you and your anti-aging journey? For me, it's not, at least not right now. So in this video, I am going to tell you 5 extremely important and maybe even concerning things that you need to know first before you get Botox. I'm Dr. Maren Locke, known as the Budget Dermatologist on YouTube, where I help you make skincare simple. So I have extremely expressive facial muscles, and I'm not shy about that. I have some really intense lines on my forehead. I have gotten Botox in the past, probably a total of 2 times in my life, and it's just not for me. I have never done it since. The last time I got it was about 7 or 8 years ago, and let me tell you, I could get Botox whenever I wanted. I could do it for free on myself if I wanted. That would probably even make a really cool YouTube video, but I'm not gonna do that. So that should tell you a lot about what I really think of Botox. But no judgment if you get and love Botox. In fact, I inject my own patients, my friends, and my family with Botox who request it. I think it is an incredible treatment that works and it does what it is intended to do, but it's just not for me. Maybe I will get it again in the future, but for like the last almost 8 years, I just have not been able to talk myself into it again, and you will understand why by the end of this video. First, let me explain something to you about Botox that you may not know. Botox is not your only option for injectable wrinkle treatments. In fact, Botox is just one of the brands that offers a neurotoxin product that paralyzes the muscles on the face to reduce wrinkles. Other options or brands include Dysport, Xeomin, Jeuveau, and some other new ones that are being developed as well. So this category of products are actually called neuromodulators, and any one of these brands can help you achieve the result of less wrinkles. Now, I find that in the mainstream, that everything in this category just gets lumped together and called Botox. So when I refer to Botox in this video, know that I am actually referring to neuromodulators as a whole category. I'm not singling out just Botox. So you will learn 5 problems with neuromodulators in this video. So Botox, or neurotoxin, comes in a little glass vial that is drawn up in a syringe and injected into your face with a small needle. The neurotoxin is placed deeper to your skin into the muscles that are responsible for your facial expression. Most commonly, it is injected into the forehead muscles that cause those horizontal wrinkles on the forehead when they are contracted during facial expressions. It is also placed in the glabellar complex that is responsible for these vertical lines or the 11s to help relax those. And it is injected into the crow's feet, which are those radiating lines on the outside of the eyes. Botox can also be injected into the areas of the lower face and the neck as well. Now, the neurotoxin, when placed in these facial muscles, takes anywhere from a few days to 2 weeks to fully kick in. And when it does, those muscles are paralyzed so they don't contract as forcefully, and then your skin overlying those muscles therefore will not scrunch up. It works and it is effective. But here are the 5 problems with Botox or neuromodulators that you need to know. Consider these for yourself before you go out and get your treatment. Number 1, Botox is expensive, and the price is only going up and up and up year over year. Typically, a ballpark estimate on price to treat the major areas of probably just the upper face is around $500. It is a substantial amount of money to consider for something that is, and that brings me to problem number 2, it's temporary. So problem number 2, Botox is temporary. All neuromodulators, including the other brands I mentioned, last only for 3 to 4 months on average, And for many people, it lasts even less than that. So $500 a pop for 3 months is $2,000 per year to keep your face Botoxed around the clock, year after year after year. Which brings me to problem number 3, issues with repeated use of Botox. So for these people who get Botox more than once, did you know that you can develop antibodies to Botox, meaning it stops working? Or you need way more units than you used to, which means it becomes more expensive for you to get it each treatment because you need more product to achieve the same effect. So what happens is that your body notices this foreign toxin that it hasn't seen before and makes what are called neutralizing antibodies to try to protect itself from this toxin. So then the next time you get Botox injected, your body already recognizes it, and those neutralizing antibodies are already present in your system, and they go and prevent the Botox from effectively doing its job to stop your wrinkles. This is real. Dermatologists and injectors everywhere can speak about this phenomenon that is seen commonly in the office. Patients will come in and say, the Botox didn't work this time, or the Botox only lasted 6 weeks this time. This doesn't happen to everyone, and for some people it happens sooner than others, but beware, you may develop a tolerance to Botox and it will not maintain its effectiveness for you over time. There are also some patients who just metabolize Botox way more quickly than the 3 to 4 months that it typically should last. Unlucky. So that is definitely something that you need to take into consideration when planning how frequently you get this injection. And another consideration if you want to get Botox injections repeatedly is that your muscles can atrophy over time. That means they can shrink and weaken. Think about it. If you don't use a muscle or work that muscle, it shrinks. Have you ever seen a broken arm or a leg after it came out of a cast? All the muscles are so atrophied compared to the healthy arm or other healthy leg. The same thing happens with your facial muscles if you keep them under constant paralysis. This can give your forehead a bony look where your skin looks thin and the veins can look more prominent, and you will look much older. This is a very aged appearance. Really thin skin with a very thin atrophied muscle layer sitting right on top of your bony forehead. And something else to consider, while we do believe that Botox is safe due to extensive studies with short-term use, we don't have extensive studies on long-term safety data in individuals who get Botox repeatedly for 10, 20, or 30 plus years. And with the trend now being preventative Botox and the encouragement for people to start in their 20s, this should be a real concern and something to take into consideration before embarking on this journey. Problem number 4, and probably the most important here, is that Botox has side effects. You need to know and understand both the common and rare side effects to decide if this risk versus benefit is worth it to you. I will say that Botox has extensive safety data and it is widely used. The side effects are rare overall, but they do happen. Just because your friend had Botox with no problems doesn't mean that you will have Botox with no problems. And just because you had no problems the last time you got Botox doesn't mean you won't have problems this time. So know your risks. First of all, you may end up not looking like you envisioned at all if the Botox is placed improperly or injected into the wrong muscles, which is easier to do than you would think because these muscles are small and very closely connected. Or if the Botox diffuses a little too far, you can get droopy eyelids that you cannot open all the way, or a dropped brow. You can get asymmetry in your face or this weird curvature pattern to your forehead lines, or even a Spock eyebrow look. And not all of these poor outcomes can be fixed. You might just have to wait 3 to 4 months for the Botox to wear off. To me, the biggest deal is the droopy eyelids, which affects vision and is very problematic in appearance. You will minimize your chance of having one of these poor outcomes by getting your Botox from an experienced injector. However, even when the Botox is placed technically correct, some people will still develop some of these poor outcomes because Botox is unpredictable. That's rare, but it happens. Now let's talk about even more side effects. One of the more common side effects is a post-injection headache. For some, this may only last a few hours, while others, it can be days to weeks of a constant headache. This was something that I actually experienced each time with Botox, and it was not fun. It is more common than you think. Of course, pain at the injection site is expected during the procedure, but it is tolerable for most people. You can expect bruising, which can take some time to resolve. You can experience vision changes like blurry vision or double vision. You can have an allergic reaction, which in some cases can be life-threatening. Again, these things are all very rare, but they are possible. And some newer reports I am seeing in the literature and hearing about from other injectors is this phenomenon of skin atrophy at the site of Botox injection, which means you are basically going to see these dents or divots in the skin. Most of these have been shown to resolve with time when the Botox wears off, but a noticeable depression or depressions over the forehead is a really alarming look, and this is something to beware of. Now, there are also reports of rare side effects that have been documented in the literature after Botox injection for wrinkles, such as weakness in muscles that were not even injected. And people with certain medical conditions should not get Botox at all. So be sure to explain your full medical history to your injector. And problem number 5, Botox is a gateway drug to more expensive and riskier cosmetic procedures. I see this all of the time. Once you get your feet wet and see nearly instant results from this procedure, you quickly start to consider the next thing, the next tweak. And how you look with your Botox becomes your new baseline for what you want to look like in your mind. And maybe after that, you branch out to fillers or some other cosmetic procedure, just a little bit here and there each visit, and slowly over time, your deviation from your natural look gets further and further until you are unsure what exactly is your baseline. So even though each of these changes may be subtle from one visit to the next, these little changes accumulate over time. You can actually drastically change your look into something very unnatural, even if this was not your intention. It's like once you get going in the middle of this journey, you lose your way. We see this with celebrities and influencers online so often now, as they just morph into this shockingly different physical version of themselves. And while this may be the goal of some people to look this certain way, it turns out that for many people, this leads to a sort of body dysmorphia and feeds depression and anxiety and just this overall negative view of themselves, constantly tweaking and changing their face to get to some other version of themselves that they never actually attain.